Health professionals like myself, whether they're nurses, EMTs, nurse practitioners, when we go into these kinds of professions, we are already coming into it with the idea of helping others. That, along with the mission of Red Cross, which is alleviating suffering, really go together. And wherever you are in the cycle of your career, whether you're just starting as a new grad, whether you're a full career person like I was for 30, 40 years, whether you're retired and you want to continue or find that way to give back, this is a great organization to do that. There's so many ways to tap into the passion that you have.
There are many different avenues and many different positions that you can use your skills in many different ways.
The obvious things, of course, are working as nurses and working as EMTs in disasters, in shelters, in family assistance centers. In terms of disaster, you're either preparing for the disaster, you're responding for the disaster, or you're recovering from the disaster. So there's constant things to be involved in that. Plus leadership areas where we're working with teams of people, how we work with our community partners, our government partners. We might be involved with teaching the communities even before the disaster. We also get involved in dispatching, where we are coordinating the teams that are responding. Mental health as well, the emotional trauma of going through these things. So our health professionals are trained in disaster-related response.
Just like in the hospital situation as a nurse, we work with different departments in the hospital to get our patients well and to get them out of the hospital back to their homes. We're doing the same thing in disaster health nursing with working with partners out in the community to get people back to their routines, on the right path, help them with their health, help them with their assimilation back into their communities. Also, we're there for the volunteers, to be looking out for them to make sure that they are healthy at whatever situation or event that they happen to be participating in.
We are there at the worst moment of their life. I mean, a fire has destroyed everything. A tornado has come through and ripped up everything. All of these kinds of things have happened, and it's a chance to really work together.
Most people think about just the disaster aspect of Red Cross, which is by far one of the things that gets many of us engaged. But there's a lot of other things besides disaster services that Red Cross is involved with. There's blood services. There's education that we do throughout the communities on a variety of things. There are services to the armed forces where we're engaged with the military and the people that have come back from military service. So there's a lot of different ways to get engaged and different things to do with Red Cross. I really see volunteering as a career. It's a part of who I want to be, and I think it is for a lot of people.
Being a volunteer for the Red Cross has probably been the most rewarding part of my career.
I retired in 2012, and my retirement plan was to volunteer. I was looking for an opportunity to give back in a way that I could also balance my life with my husband, with traveling, with my family, and I really saw Red Cross as the way to do that.
It gives me an opportunity to serve. It's a very rewarding experience.
I volunteer for the Red Cross because I enjoy the mission and what it stands for. And by being that nurse, I'm giving back, I'm helping, and that makes me feel very good.